had people that were staying here 8, 10, 12 hours a day. Once you make it a smoother process up front, you can get those extra jobs done during the day during your regular business hours.
Welcome to Unjargoned, a podcast about healthcare workflows that make sense without all the acronyms. We talk to people on the front lines of healthcare and explore cool solutions they're using to solve real problems. I'm Angie, product manager here at Luma. I've been with the company for about 10 years now, so everything that you see and breathe in Luma, I can probably help with that. Dave?
Hey, everybody. I'm Dave Smith. I'm a revenue leader. I am a young pup compared to Angie. I've been here 6 years, and I live and breathe access every day, being a type 1 diabetic. I understand the benefits of when health leaders lean in and they look for innovation around workflows. I live and breathe the receiving end of the patient experience, and really excited to have this session today with Felicia.
Well, jumping right in, Felicia Jamieson is the Director of Revenue Cycle, overseeing the financial and administrative engine behind Permian's care delivery. She led the hospital's adoption of the full end-to-end revenue cycle platform with Waystar, consolidating what had been 3 or 4 separate systems all into one workflow. That same instinct for replacing fragmented processes extends to all the work that they're doing with Luma Health, where the team is implementing a save the place in line, wait time estimator, and surgical loved one notifications across quick care clinic and surgical workflows. Well, welcome, Felicia. It's so nice to have you.
Nice to see you.
Yep. Felicia
Thanks
is
for having me.
the cool kids would say you have aura. So we are lucky to have you.
Let's hope that it's a good color aura and not something that's, scary.
I've heard about the different levels of aura. What level would you currently rate yourself at?
Oh, I have no idea. There are days when I'm red and orange. Look, I live red. I go all in all the time. And so anything that's high energy, anything that's high energy.
Strong. Okay, well, you're going to get along great with Angie. She's got the ultimate aura at Luma.
Yes, yeah, I bet you.
Yes, exactly. Yeah, so maybe could you just listen? We'd love to just brief the audience, Felicia, before we get going. Just a little
First.
yeah. Oh, you want to go rapid fire first before
I
we
think
do
that's what
any
we're doing.
intros?
Yeah,
You're
I
gonna
Let's
thought
hit me
that's
with
go.
them in the beginning. You're gonna hit me with them at the start.
Go.
yes. We're trying this out. And so I'll start with the first one. What's your go-to karaoke song?
My go-to karaoke song, let's see. Mine, it has to be anything by Patsy Cline. Probably Crazy. It's probably just because she's nobody can do it better than Patsy Cline.
Love that. And what's your favorite day of the week and why?
My favorite day of the week is usually Saturday or Sunday, but it's because I get to play golf.
Love.
Yeah, that's whenever I can have my 18 holes of silence and just, it's where I find peace sometimes.
Do you
So.
like to walk or do you like to drive the cart?
I don't walk. I don't walk anywhere, Dave. And I'm usually the cart bunny, so I usually ride. So Wes drives, my husband drives. So yeah.
And what's your favorite club to hit?
I have a Callaway 6 hybrid that I have recently picked up this year that I just love to hit that. I have that and a Callaway chipper. So I like chipping and putting. So
Nice. Okay, well, hold on. One other rapid fire question. What is your least favorite place to play golf?
are there really bad places? My
I
husband
don't.
set up a golf course in our backyard with buckets and wiffle balls. There's not a bad place to play golf. I can't.
Strong.
Yeah, we did play in Utopia, Texas one time, which is what the movie 7 Days in Utopia is about. That course exactly. And there were hogs, like dead pigs, on the first green. And we went by the clubhouse to tell them that he was out there. And he's like, oh, yeah, they shoot them at night. So if anybody's ever visiting Utopia, Texas, you might see some sights there. So it was a cool experience because of the movie, but it was crazy.
What's the thing that makes you laugh the most? It can't be Dave, please.
Oh, no. It's when all my kids are together in one place because they have such different attitudes. They're 30, 26, and 18, and so to see them all together, they can just make me roll. And the son in the middle is a nerd. He's just great. He'll say anything to be the life of the party. So when I have all my kids together, that's when I laugh but we belly laugh. So it's the most fun.
I love that so much. So, how'd you end up in Andrews, Texas, running like the whole business operations for a hospital?
I actually grew up in West Texas, so I'm used to rural hospitals. I'm used to rural America. I grew up right down the road in Kermit, Texas, which is in Winkler County. They have a hospital there, critical access. I actually have a 25-year finance history behind this. So I came out of banking, but I came out of the credit union side of banking, so the nonprofit side of finance. Did a small stint in oil and gas where I was chasing saltwater. You think that a hospital bill is hard to chase? You should try chasing molecules of salt water.
Wow.
It's crazy. So analysis on saltwater. But how I actually came to be where I am now is I was hired as the controller for Winkler County in 2015, 2016. Came in with really no healthcare background, but had all the finance background to do the controller job. But while we were there, we turned it from a county-owned hospital into a hospital district. We were able to get that election passed and kind of grew it. And so then I left for a bit, and my husband and I moved to Andrews, which is right up the road, about 45 minutes away. Went into a small stint in youth ministry because that was a calling at that time, and then was offered the business office. And at that time, it was the business office director position here, which is now developed into the revenue cycle director. And so I've learned so much over the last 5 years about revenue cycle and just what other job do you do? I don't think I ever experienced this anywhere else where I was at, but what other job do you do where you do the whole job and you only get three quarters or a quarter of what you put out? People don't understand that about the revenue cycle. You have this much in charges, but you're only going to get this much in payment, and you have to learn to live on that. But it's always been nonprofit. Other than my small stint in the oil and gas industry, it's always been nonprofit. It's always been helping folks, helping organizations with taxpayer bases try to expand and just do the right thing.
Felicia, I'd love to hear just a little of some of the things that you're looking forward over the next 1, 3, 5 years that you think is going to bring more service to the community that y'all serve.
Well, I mean, we can take it back quite a bit to 30 years ago. I told you my oldest child is 30. 30 years ago, I drove from Wink and Odessa 30 and 26 years ago to have both of my children in this hospital. And this hospital, Permian Regional, holds a very special place in my heart because my grandmother had surgery here, my aunts all had surgery here, my cousins were born here, but we drove from out of town to come here. Then it was a 3-story hospital.
Wow.
Just had a few services, not a whole lot. Since then, we have built a whole new hospital, which is large, including our previous CEO added a memory care unit. So we have one of the only memory care units in West Texas. We've added ththings like cardiac. We've added things like surgical services. We have dialysis now. So it's one of the only dialysis centers within about a 45-mile range around
Yep.
us. When I was first coming here, it was just a birthing center and a couple of physicians back 30 years ago. And that goes to how the communities have grown, right? When I grew up in Kermit, there were probably 5,000 people. Now there are 15,000 people there. It's
Yeah.
busting at the seams. Andrews is the same way. When Wes and
Yes.
I moved here, my husband and I moved here in 2020, there were 3 houses available in Andrews, Texas. And you live in rural West Texas, you are depending on the oil field for your livelihood. You don't depend on anything pretty much other than the oil patch. We'll call it the patch, I guess. Nobody out here calls it that, but you depend on the markets to drive what you do. So we've seen people at their highest high. I mean, most millionaires per capita in Andrews probably about 10 years ago to their lowest low in the 80s when there was a bust and our parents were just looking for work and just trying to keep afloat. A different kind of people out here, Dave, that to provide this level of healthcare in an area where people just kind of forget about you at times is saying something, and it has just come a long way. And with Permian Regional, I mean, going into the AI, we're starting to use all of those things. So those are things. Technology isn't something that you find in every rural hospital. Just doesn't happen. Can't afford it. Don't think they can afford it. Can't get out. Don't have motivated CEOs to step out and say, hey, this is the direction we want to go. And we've really taken that and ran with it a little bit. And my CFO says, we want to be the innovators in the rural market, and let's run with it.
Well, I think we can dive into some specific workflows, but I think with this piece, it makes sense given that we were talking about this earlier about like People and finance are your passion. That's what it says on your LinkedIn. And all of this permeates through the rest of the organization. So tying that to the work that you do every day, revenue cycle sometimes just feels like a lot of billing and paperwork, but the people actually doing that know that it's not like that at all. So like, what do people misunderstand about that? And how does it bleed into like, how do you decide what technologies you need to better enhance the patient experience, even if you may not be directly interacting with them every single day?
We have a 44-person staff just in the revenue cycle, and so that's a lot for a small town rural hospital, right? But the thing about it is you have to get we want to talk about people and finance and how that all ties in together. You have to hire the right people that are going to buy in. And you have to have a team who loves what they're doing. And when you offer them a new technology, everything that we offer, they are the first ones to use it, the first ones to tell us what's going wrong, and the first ones to help us fix it. There are a lot of technologies that we've actually got to be on the forefront of because we are members of Torch and that kind of thing. And so there's a lot of connections there where we've got to be on the forefront of it. They've built products for us. They've built systems for us so that we can because our team buys in so well. I think that's it. You have to get the team's buy-in. We have people that have been here 25 years and they're still willing to use that new technology and go, "Oh, that's going to make my life easier and make it easier on the patient. Let's run with that. See how we can make it the best that we can." And then move forward. And I think that's it. Finance and passion. So finance is boring if you're not a numbers geek like me. Like I love to see things add up. I love to see things reconcile. People come first. And that's the thing is you won't have the money, you won't have the revenue, you won't have a revenue cycle, you won't have bills if you don't take care of the people. At one point in time we had a broken statement system and people were just mad and they quit coming until we got that back on track and made that technologically advanced. The scheduling systems that we have now, the wait in line, they don't have to wait anymore at a quick care clinic. They don't have to go to our quick care clinic and sit in the lobby when they don't feel good for 90 minutes when they can look and say, okay, I can either save my place in line or I know what the wait times are. So I know that I can go at this time and it won't be as long as it is right now. This is a peak time.
How do you find these sorts of workflows and projects?
We have consultants who have worked with us over the last year. This has helped. So we had a really good consultant she has made it her mission to help in turnarounds of rural hospitals. We weren't in the best position for a while. She came in, she makes those relationships. She introduces us to these folks, like Luma or like Waystar. They introduce us to those people, and we've developed those relationships with those people. That's how we're finding them, really, is you have to network them. It's kind of like I feel like that the people at all the at Luma and because we've gotten to know each other well, are friends. And so I can call up Spiro or I can call up Dave and be like, hey, we've got this problem going on. Just networking, being at those places where you can meet the right people at the right time.
Let's take something as simple as scheduling and access. How do you think about that now? And what are some of the changes that you've made that you think have made a big difference in your ability to provide better care, but at the same time run an efficient revenue cycle process?
What's been great over the last year with all of the scheduling processes, what we were having was we were having people call into our clinic and they were just whatever admissions clerk they could get, whatever person in the back they could get, that was the person that was scheduling their 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 visits. And what we've done is we've created a centralized scheduling unit now where all calls flow through them. They use the scheduling piece to schedule that patient. But while they're scheduling that patient, because of some other things that we've implemented, they're able to do pre-registration, eligibility, pre-service, get the money up front. So and then whenever they get here now, because of the products that we've invested in, they're able to just text arrived and they never have to stop at a desk. Everything is easy flow, and that message goes back to the nurses, and then they don't have to stop at a desk, give all their information. They've already done that on their time instead of doing it on our time.
How do you think the staff has responded to all of this innovation? Because very curious some of the patient feedback, but just what has your team told you as y'all have managed to do something really hard? By the way, there's really large health systems that have billions of dollars of margin who can't do what you just described.
Thank you. Thank you for that. The way that the things that we were staying here anywhere from 8 to 10 to 12 hours a day trying to get the additional jobs that we had to do because I know I say 44, but in a revenue cycle as large as ours, we did 62 million last year in revenue, in gross revenue. That's not small, right? So we had
Yeah.
people that were staying here 8, 10, 12 hours a day trying to get everything done because we had extra jobs we had to do. What we didn't realize is once you take that stuff and make it a cleaner process and a smoother process up front, you can get those extra jobs done during the day during your regular business hours.
Yeah.
So work-life balance, I think it helps with work-life balance, even for me. There were a lot of things that I was doing on the back end that now I can do analytics and run reports and do those kind of things that I can do it during my day instead of having to do it away from my family on the nights or the weekends or whatever. So they buy into that because they have a better work-life balance than they had before. They don't leave here worrying what they're going to have to do tomorrow. It just makes it easier for them.
That's so great. Has that also built trust with the clinical staff, the teams, the front desk clerks, the providers? Tell us about that.
Because patients are putting in their own information, all we have to do is go back and check that. I think that's a big deal too, because a lot of the times I would, if it were me, I'd miss something. But the patient is putting in their own information. They're able to do that. The providers love it because the patients are getting back to them quicker. We had so many complaints about they're just taking too long up front to get them registered. They're taking too long up front to get them in. And now when they come in and click arrive, they're already in. So our physicians are actually seeing on average probably 30 to 40 more patients per month
Wow.
because they can move them through that and we can schedule more. That's part of it too. We changed when we went to centralized scheduling, we were able to open up more schedule spots. And so they're able to like stick them in and they still spend the time that they need to see with their patients. They still get that quality time, but that patient not having to spend 10, 15 minutes at the desk is definitely helping. That pre-registration has been key for us. Pre-service, pre-registration, catching the money up front, that helps too. I'll kind of do a financial thing, Dave, if y'all don't, and Angie, if you don't mind.
Yeah.
We went in 2022, we were collecting $60,000 a year in pre-service payments. Now that's the hospital and the clinic. Got to think about all the people that come through here. That's nothing. Now my staff is collecting anywhere between on average 120 and $140,000 a month. They're on pace to hit one because they're doing it up front. They're asking for the money, they're sending out the link, and they're able to get that money up front now. And people are willing to pay it because they don't want a statement in the backside. They'd
Yeah.
rather have it up front, know what they have to pay. Estimations have been a big deal. That's been price transparency has been a big deal in healthcare, right? So estimations has been a big deal. We can show them this is what you're going to owe. You can either pay it today or pay it later. And a lot of people, you would be surprised because we did have some pushback when we started that because in Andrews, they were just told, oh, they'll just get a statement at the end, right? Well, nobody wants a statement. And if they get the statement at the end, they're more than likely not going to pay it. But if you have them on the phone or in front of you, you can say, hey, how do you plan on paying for that today? And then give them options.
Yep.
That's been the best way to take care of that. But so the public has adopted, that's an adoption right there, right? The public has adopted that they weren't going to have to pay. They were going to get a statement. Now they say, okay, I know I'm going to have to pay when I go in.
That
So
is
what do you think is,
insane.
yeah.
We gotta pause on those mic drop moments, okay? Like
Yeah.
Yeah.
that is actually insane. From 60,000 a year to like over 100,000 a month. Like what? I'm gagged. I'm like trying to process that information. Something we hear a lot is like it's a lot of drain for patients to come in and like have an awkward conversation with the front desk. They might get upset and then now everyone in the waiting room is a little bit agitated and the person at the front desk way beyond what they want to do every single day, they're busy trying to get patients in. And so I feel like we hear this quite often where people are just surprised how willing patients are, and yours is like a true testament to that. It's amazing to hear. That's crazy.
Yeah, it's crazy. It's crazy numbers. And, it just, in my CFO is always asking me, how are y'all doing it? I said, we're asking for it. And people know healthcare is not cheap for anybody.
Amazing.
What,
Amazing.
Felicia, what's next with that? How do you think you'll communicate? Let's just stay on that for a second,
Okay.
because I think there's something really fascinating about what you mentioned, the human behavior. How do you plan to take, because to me, that's trust. Okay. Y'all are building trust. And what's also, by the way, another mic drop is the fact that you have most times to do what you've done will frustrate the heck out of somebody downstream. Okay. Because maybe you've machined this really noisy process to get the money. But then the patient walks in and they're frustrated to all hilt because, yes, they paid you, you got your collections. But now the front desk is dealing with, we hear that a lot because revenue cycle, what you have built is not really revenue cycle. It's actually something much larger. So how do you think about taking now, because you've introduced us to, we're doing centralized scheduling. We're getting the patients to complete information. We're getting them to prepay. What happens now post-visit? How are you thinking about the long tail of care and how you're communicating with them and getting them scheduled so they do their follow-ups, they do their PT, they do their labs? Give us a lens into what you think is next for you there,
I
if
think it
anything.
Yeah, well, and it all comes down to, the follow-up. We have really great nurses and really great referral nurses who follow up on those referrals, get those things booked. A lot of the referrals get to go to our facility for labs, x-rays, that kind of thing, because we have full services. So we try not to send anybody away if we don't have to. So we have referral nurses who grab up those referrals from the physicians and they go ahead and get them scheduled for rad, get them scheduled for lab. That way, and it's everybody just working together, Dave. It's everybody just working on the same plane and understanding the vision is to make this not just about money. It's not. It's about making it one of the best healthcare facilities in West Texas and giving it to people who don't have that because they don't have a hospital within 25 miles of them, or they do, and it's just not the same caliber. That's part of it. But the other part comes down to the backside of the revenue cycle, right? We have to bill it right. We have to show them the estimate up front and say, hey, this is how much money you're going to owe me. But if they get a statement that shows that it owes 300 and we didn't do any more services, something's broken. And we have to work on a process because they won't trust you at that point. If they're giving you money up front, you've got to make sure that it gets billed right. And then if they get a statement, that statement states exactly what that estimate says. This is an estimate. We added a test, whatever. You can't just send them a statement on the back end saying that they owe a lot more money. You have to get the billing process right. And we've worked on that. We have another team too that works with us to kind of help. And what we realized is, I told you we had $62 million in revenue. The thing is that we had $62 million in revenue and I had 3 billers total for the facility. What we have to do as revenue cycle leaders is we have to realize when your hands can't handle all the work, you've got to bring in someone else. If you don't have the funds to hire a whole bunch of people, you got to bring in somebody else who's an expert to help you as well. So it's not that we weren't experts in our fields in any of this. It's that we didn't have the hands to get all the work done. You have to make sure that trust flows all the way through. And if you're telling a patient up front, this is what you're going to owe, and then they owe too much at the end, that's what this ultimately comes down to. You can't send them a big statement at the end. You got to get it right. You got to get the process right.
Yeah. And I mean, I know documents, faxes, referrals is right up your alley.
So touching back on getting it right is like really important because it's so true. I don't want to get a bill after I already paid. Like, what are we doing here? Even if I might owe more. And so a lot of effort that we're doing here is through getting a document in, whether a patient's due for care, an order, a blood test, a follow-up mammo, whatever it might be. And then we can run it through Prior-Auth. And so the goal there is maybe we need Prior-Auth before the patient can schedule. Maybe there's a care gap there. How are you guys solving this today?
So we do have a Prior-Auth piece, and we can kind of talk about that. The document, the order comes in, we do use a fax service that sends it into their email. So they do get the orders from the fax service or through our core system, which is Meditech. They get the order. As soon as my schedulers get that or the referral nurses get that, they begin on the authorization process then before they ever call the patient. Again, that's part of that pre-service process, right? We want to make sure that we have an auth. We want to make sure the eligibility has been ran. All of those things, if they happen prior to that patient getting the phone call to have them scheduled, it's going to go a lot sooner. I hate to hear them call a patient and go, okay, we're waiting on your authorization before we can get you scheduled. That's just, let's go ahead and get it up front. And putting it through technology systems and using Prior-Auth. Usually you had to call every insurance company. You had to go to the websites. Now we have a system that we can run a lot of those. Now, not every payer is in that system, but we can run a lot of them. And it has AI attached. So you can watch the bot, which has been the funnest thing for me because I'm kind of a nerd like that. But you can watch the bot sign in for you and run the authorization and do all the things. And then it only has to stop for clinical questions. right? And it just keeps going. And you can run that while you're doing something else. You can be scheduling another patient while you're getting that authorization. So that's another workflow that we've put in place where a lot of it has to do with technology and how it just moves through to people up front, getting the right people to the table. We kind of had some trouble with that. And I talked about this a while ago, but we had some trouble with getting the right people to the table with our authorization process with the bots and that kind of thing. And so once we brought on the clinical providers, we found out that they had their own opinions, and in working with them together, it's become a lot smoother process. But in the beginning, it was really hard because I don't want AI doing it, number one, and number two, just you can't answer clinical questions when you're a financial. No, we can't. So we're going to bring the clinical people, but we didn't discover that till about halfway through. And so bringing the right people to the table during implementation is a big deal too.
Mm. As you think about communicating with patients through all of this, and you brought up AI, I know that you were part of our cohort to build agentic voice. How are you thinking about leveraging agentic voice to support this trust that you've built through this process called revenue cycle?
Right. With AI for me, sometimes it can be a bit stale. It's all in how you train it. It's all in how and so with agentic voice, I think I was watching them during the Meditech cohort and just seeing how that works. I think it's all in training the AI to speak to people in maybe not technical language. Let's make it seem like they're actually talking to Felicia on the other end of the phone. Not to fool them by any means, but to make them feel more at ease. You talk to me, I say things like y'all and all of these things. I don't want AI to say that, but it could, if you needed that in a certain, like out here where we are, we talk about there's a difference in Spanish. There's a difference in Spanish dialects, right? And out here it's a little different than if you went to actual Mexico and those kind of places. And so maybe even using people who speak those different dialects and those different languages, or have those different accents, because everybody says I have one, but I don't think so. To kind of
You sound
buddy
like you're
up to
from New
that.
York.
Yeah,
Felicia,
sure.
yeah, I
Sure.
definitely think you're from, maybe Providence. You have quite a deep.
I've got some consultants from there. We don't understand each other all the time. They're teaching me.
Exactly. It's the language of money.
Yes. Yeah. But I think it's just making people feel comfortable with it too, right? You
Yeah.
have to not make them seem like, hi, this is the robot. I'm telling, you've got to make it,
Yes.
hey, this is so and so, and I'm here to help you. I think that's part of it. That's really part of it, is making people feel comfortable with it.
What percent of your so we had another guest share a workflow idea with us. I'll share it with you, and you tell me whether you think
I like shared workflows.
so in the outreach game, right? Whenever y'all are doing outreach, either it's peri-op, it's for a referral, it's for a recall, and that outreach is typically done through either the call center or a reminder, an SMS reminder. And
Mhm.
what they were saying was, hey, it'd be really wonderful if we could leverage a message that went out and essentially had this concierge sort of feel that said, hey, Felicia, we received your referral. We'd love to get you scheduled. You can click here and do it yourself,
Mhm.
or you can tell us a time and, Angie, our scheduling agent, will call you back. And so if I say, yeah, I'm in the middle of a meeting, call me back at 4. And then at 3:55, a text message goes out and says, Felicia, hey, Angie's going to call you. And then
Yeah.
your phone rings and it's Angie, which is an agentic solution that introduces themselves and says, hey, this will take 3 minutes, right? It's built by Permian. Let's get you scheduled. Here's a few questions. What percent of your patient community do you think would leverage that, and why?
I think it would take a minute. Education is key to our public here in West Texas. But I think if we made it to where they were comfortable with it, again, that's the key. I think just getting the community comfortable with that kind of thing. But they may not even know that Angie's not Angie. They may not know that Angie's something else, but it has to sound natural. It has to have that natural workflow.
Mhm.
I think that probably if we could probably get, because of how accepting they have been to everything else, 50 to 75, I would hope 50 to 75% of our population would use that. It's not always convenient when I call you to schedule something. So I would love to get a text message that just says, "Hey, are you available right now? Or do you need time?" And just send it back. And that would also help in our centralized call scheduling, right? We have to talk about the dirty word, which is staffing, right?
Mhm.
And so sometimes that is the biggest part of my budget, period, is staffing. Not that I would ever, and I never stand up for cutting people for just cutting people. It's just not the way that I live. It's not the way that I've done business. It's not the way that I carry myself. However, as you lose one, maybe to attrition, if you could add this in to help kind of help out with that staffing model as well, right? So you don't have to, yes, you need to cut your budget. Yes, you've lost one of your good players, but hey, I'm going to replace it with this agentic AI model that's going to be cheaper in the long run, to dirty word, like I said. But that to me is a pretty killer idea.
Also, it's
Yeah.
not just voice. I feel like a big thing for us is like, for me, for example, I hate calling anybody. Like, if there's a chat experience, if there's a text, even my mom, I'll probably text her first and then we'll hop on the phone. And so I'm just really awkward on the phone sometimes, and it's just not my favorite place to be. And so, a big thing for us, did you find your patients being interested in doing like a text conversation where you just text back and forth? And they don't have to hop on a call at all without having to go into a chat bot, without anything else. Our whole goal is to like meet patients where they are. And for me, for example, I'm like, meet me on my phone where I don't have to pick it up. Whereas it's like my other product manager on my team, she's like, I love calling. I get so frustrated when they don't answer. So I just want to hear your perspective on that. How open do you think your patients would be to just text and chat back and forth,
Well,
especially
I
younger
think
demographics?
as the generations change, right? So I have some millennials, I have some Gen Zer, I'm a Gen Xer all day. But we all have different communication styles, right? And so my daughter would rather not, either one of them, they would just rather text. The one that just turned 18, she'd rather, she's like, "Mom, I'm scared to call the doctor's office." Well, maybe you don't have to. Maybe you could just send a text, right? I used to have friends in my generation who their mom would call them and they talk on the phone. A lot of them now, and with my mom, I text her every day. It just is the way that the world is going. And I think a lot of our population likes that too. Again, I told you that we work in the oil industry, a lot of us. And so those hours, my hours of operation are not always the best hours for those folks because
Mm-hmm.
they're out working hard from 6 a.m. in the morning until 8 a.m., 8 p.m. at night. So a lot of them use text and things like that to schedule that already. And so I really think that it would be a big adoption in the text avenue as well. Talk back and forth. And then you really don't know who you're talking to, right? Because it's all technology. You don't know who you're talking to. And so I think that's depending on the generation, but as the older generation ages out, I think this is going to become the way. It is just the way of life for all of us.
Hey, Ange, can I hit rewind for a second,
Yeah.
Felicia? This clarity around the financial impact that you've nailed with the revenue cycle process. What do you think if you were to try to come up with the same economic value of what y'all have been able to do with Save Your Place in Line and Wait Time Estimator? What do you think that has, like, I understand the value to the patient,
Right.
and you had shared that story of them not having to sit, or even, if they have to drive in, they don't get in their car till, they have context. Like, I understand that, but how would you translate that impact into something that's materially financial?
Well, again, you can look at it as just time spent, right? And so time spent is money spent. And so with these wait times, people aren't, sitting in my lobby, sitting at the desk, doing all those things. They know they can come, they can pre-register online and come in immediately. So again, you don't have them sitting at a desk. Potentially, we look at staffing in the model again, right? And you say, okay, well, if I have this many people who are scheduling ahead or save place in line, so I know this many people are going to be in, you can say, okay, well, I only need one registration staff right now because I know that this many people are, even though it is a walk-in clinic, you'd still have to catch some of the overflow. But I think financially, with save place in line and wait time estimator, that's going to help, right?
Yeah.
physicians may be able to get more people in. You got to look at the numbers on the backside, and we haven't been in it long enough to really look at the numbers on the backside to say, okay, people walk out. People walk out of your clinics. They have to wait 90 minutes, they're walking out. But if you can show them how much time they have left or save their place in line, those people know when to be there, and they're not going to walk out. So you're going to have some economic impact there too, because you've potentially lost on, 5 or 10 patients who would have been in your clinic but decided that they were mad because they had to wait in the lobby for so long, and they went down to the XL emergency room down the street instead, or they come into my emergency room. That's another one, right? So if they get tired of waiting at the quick care clinic, which we all know that an emergency visit is probably 3 times more than a clinic visit.
Yeah.
If they get mad, the first place that they're going to hit, if they don't hit the freestanding emergency room, is they're going to hit my ER. And then what?
Yep.
They can pay the $150 at the clinic, but they come to my ER and they can't pay the $1,500 bill. And so there's economic impact there as well.
It's super interesting. Remind me, but didn't y'all tell us about the surgical loved ones notification? How did that come to be, and what sort of impact has that had on the community?
It's just something that was needed here because we have large families. We have different cultures here that have very large families, and they're all in the waiting room waiting all together. And you just have, and they're all waiting to hear about that loved one, right? It's so good to have something. And I think that's kind of where it was. We were watching that happen. We were watching them, wait for hours, at least with the surgical notifications. We can let them know, hey, they're here. They're here. We'll be out with you in just a few minutes. We'll give you an update, that kind of thing on the person level. Plus for me, like I'll tell you a story, and if I get long-winded, y'all let me know, because that's my tendency. But my aunt was having her first baby here. He is now 35 years old. My whole family was here in this hospital. This was the 3-story hospital, so it was the old hospital. At that time, they let you stand outside the surgical room doors. So we're just all waiting to hear for this baby to, and
Yep.
you hear people screaming in the hallway, but we didn't know how she was. We didn't know how the baby was. She had trouble before. And so with things like this, it's just looking at stories of that, stories of people out here. We have a lot of wrecks. The highways are heavy with sand trucks, and the highways are heavy with traffic. We have a lot of wrecks. People have to go straight from here, back into some kind of surgery. I wouldn't say emergency because we are rural, so we do send a lot out. But when there is something critical that has to happen in our surgical suite, we can tell the patient's family, this is where we're at. This is what's looking like, without having to take away from the nurses having, or the physicians having to
Yes.
leave what they're doing. You don't ever want them to leave that patient's side, right? And so with this, we don't really have to leave this patient's side to go out and tell the family how things are going at the moment. People still want to see their physician, but during the process, they don't have to leave that patient alone or stop what they're doing. That life is important, and taking care of that life is the most important thing. And so walking away from it sometimes isn't the best thing for the patient.
It's such a great story. One more question on my end, and then Angie can rattle off things that you're curious about here. So, Felicia, I always like to ask what advice you'd give to others who might not be as innovative. Maybe they're a little more change resistant. Everyone always thinks they don't have money. And so if you were to kind of zoom yourself back 4 years ago, and you could write yourself an email that said, hey, there's going to be these crazy people called Luma, and you're going to partner with them, what would be the 3 things you'd tell yourself to give yourself more comfort and confidence to invest fully into Luma? Because like all of these programs you're doing, it's trust for us. Does that make sense? Like, so what would you say to yourself?
So first and foremost, it's always for me is change is hard, but trust the process, because at the end things are going to come out usually better. And if they're not, you can always, start again on something else. Don't ever quit. That's always, trust the process, like we talked about. I think the second is bring the right people to the table, the decision makers, but also bring your people to the table, because your people matter, because they're the ones that are dealing with it day in and day out. So you need to make sure that you're bringing everyone to the table at the beginning. And then when somebody says it's too expensive, you just have to find a way to get around that. show you have to be able to, for me, it would be looking at myself and going, you can do the analytics to show them how much money this is going to save them on the backside. Because in a long time, for a long time, I didn't think that I could do that, but you can. You can show, just like talking through this with you has given me some insight into, hey, this is saving us money here, and this is saving us money here. So look for those things in advance instead of having to sit back later and go, oh yeah. But I think trust the process, bring the right people to the table, and do the analytics to prove that you can afford it to be able to do it, because it's going to save you so much more in the long run.
Well, any final words, Felicia? I feel like this was so much fun with you.
Well, thank you. Thank you so much. Just thank you for having me today. I always thank the Luma team for being so gracious. One last thing I want to say is what we have found in the vendors that we are using now, and this isn't just blowing smoke, this is real, is they become part of our family. They become part of the Permian family, and these folks know, they've been out, they've hung out with me. We've been through Meditech issues together, but our major vendors, whenever we go out and look for another one, that family feel, just that feel that they're gonna buy into Permian as much as we buy into them. And so I just want to thank everybody from Spiro, don't tell him I said that, to Dave, yes, Dave,
Yes.
and just thank y'all for being so gracious to us. And anytime we need Garrett's great. So yeah, so that's all I want to say. And it's probably gonna get cut, but I just need to make sure everybody sees this though, Dave,
I will
because
tell them.
I love them.
Spiro's nickname, Felicia, is Megamind. Do you see how big Megamind's head is?
But,
So we
oh,
won't
man.
tell him because he can barely walk through the door as it is. His head's so big. So
You can tell Angie. I mean, well, no, there's Angie. You can tell Garrett how much we appreciate him too.
Garrett's well deserving of it. Spiro, not so much.
Yeah, the whole bunch. But we just appreciate the fact that y'all bring us all together into a Meditech environment. So because we all have the same problems, same issues, same day, maybe different day, but
Yes. Same hope. Same hope.
same hope. Yes, yes. But thank y'all so much.
Thank you. You were amazing. We're so grateful and lucky to have you. Thanks so much, Felicia. And have fun golfing this weekend.
Yeah.